Hello, I'm Dr. Nupur Sood. I'm an obstetrician and gynecologist at Cloud9 Hospital, Bellandur, Bangalore. Emotional changes during pregnancy. Now, what one expects is usually joy. But unfortunately, there are changes happening in our body at that time, both hormonal, physiological, physical, which bring about certain fluctuations in our system. Now, if you consider the first 3 months, that is the time when a little bit of nausea, morning sickness, vomitings come in. So, a person is not eating well and she feels tired, exhausted easily, even sometimes a little irritable because she can't cope up with the work. And then there's anxiety, especially if you have developed some complication in the first 3 months, like a bleeding, and you're wondering whether you'll be able to complete your pregnancy or not at all. And then there is a third category of people who have had an unplanned pregnancy, and then definitely they're upset about it. So as you proceed towards your next half of pregnancy, the morning sickness settles down a bit, you're more comfortable, but then the body weight is gaining, your body is having changes, the baby bump is increasing in size, so you have physical changes happening within you. Now this is the time when the hemoglobin levels start falling down. So you'll start feeling a little forgetful, a little tired easily, even though you want to work, you start panting when you just climb a few stairs. So this is the time you need to take in your iron and calcium supplements. Towards the end, the last phase of your pregnancy, the body weight has significantly increased. You usually put on about 10 to 12 kgs of weight during pregnancy. It's not easy to carry it off after all. And then the second part about is definitely the childbirth. You're really anxious that whether I'm going to go in for a normal or will I have a C-section. So these are certain emotions which come in with pregnancy. But I think it's normal physiology and we should learn to cope with it over a period of time. The best way you can cover up for it is have a good diet of fresh fruits and salads. They increase our vitamin, minerals and antioxidant levels. Maintain a good body hydration. Have 10 to 12 glasses of water. If not, at least some form of liquids, because there is a change in the taste of the mouth. You may not feel like drinking water all the time. You could have certain fruit juices, buttermilk, coconut water, lime juice, whatever you like. But liquids is important. Then take a good rest. Your fatigue is going to be overcome if you take a good night's sleep. What is recommended is a minimum of 8 hours of sleep at night and 2 hours of nap in the afternoon too. So that's going to help you a long way. Take in and be active. If you have been medically, your doctor says that you're fit to go ahead with certain exercises in pregnancy, go ahead, join the Lamaze classes, join the antenatal classes. They are themselves a destresser for you, as you have the company of other colleagues who are going through the same phase. And then last but not the least, have the company of your own family and friends too. The emotional changes are normal, but then you do need support at that period. And if you have them, that's the best you could have.